Welcome to Module 2 of our course on community-based clinical health. In Module 1, we examine the foundations, the philosophy, principles, and values guiding this approach. We discussed how community-based health seeks to overcome inequities and ensure health for all through participation, justice, and respect for local knowledge. In this second module, we shift our attention to practice. How do we put these principles into action? What does it mean to treat the community as the central unit of care? What are the specific characteristics of community-based health services? How do we define their objectives, and what roles do health workers and communities themselves play in achieving them? Finally, what strategies and conceptual frameworks help us design, implement, and sustain these programs? Let's dive in. Section 1. Community as the focus unit of healthcare services. One of the most revolutionary shifts of community-based health is the recognition that the community itself, not the hospital, not the doctor, is the central unit of healthcare. This approach sees health not as something delivered from above but as something built within communities. For example, instead of focusing solely on individual patients, programs look at entire households or villages. Instead of waiting for illness to appear, programs promote preventive behaviors, such as clean water, nutrition, sanitation, and vaccination, at the community level. Instead of designing services far away, decisions are made with community leaders, families, and grassroots organizations. When the community becomes the center of care, health becomes more inclusive and effective. For instance, maternal health improves when villages create safe spaces for midwives and women to share experiences, not just when hospitals expand. Similarly, child health improves when schools are involved in immunization campaigns. Section 2. Characteristics of community-based healthcare. Community-based clinical health has several defining characteristics that distinguish it from hospital-based or purely curative systems. Let's explore them one by one. Accessibility and proximity. Services are brought closer to people, whether through local clinics, outreach teams, or community health workers. Prevention-oriented. A heavy focus is placed on health education, immunization, safe water, hygiene, and nutrition, preventing illness before it requires costly treatment. Low-cost and efficient. By using local resources, training community health workers, and emphasizing prevention, these programs often deliver higher impact with fewer resources. Cultural sensitivity. Programs are designed to align with the beliefs, values, and languages of the people they serve. Participation and ownership. Communities are not passive recipients but active participants in planning, decision-making, and evaluation. Integration across sectors. Health is connected to education, agriculture, housing, and livelihoods. Community-based health programs often include cross-sector initiatives, such as teaching farmers better nutrition practices. Continuity of care. Unlike short-term medical missions, community-based care focuses on long-term relationships and continuous support. These characteristics make this model especially powerful in both rural and urban settings, ensuring services are not only available but meaningful and sustainable. Section 3. Objectives of community-based healthcare. The objectives of community-based health can be grouped into three broad areas. Improving access and equity. The first goal is to ensure everyone, regardless of their background, has access to essential healthcare. This includes reaching marginalized groups such as the poor, rural dwellers, minorities, and women. Promoting prevention and health promotion. Another key objective is to shift the focus from expensive treatment of illness to affordable prevention. This saves money, reduces suffering, and creates healthier populations. Empowering communities. Community-based health is not just about delivering care but also about strengthening the ability of communities to care for themselves. This includes training health workers, forming committees, and building local health infrastructure. For example, when a village learns how to manage its own clean water system, or when mothers are trained in recognizing early signs of malnutrition, health improves not just for a day but for generations. Section 4. Roles of community-based clinical health. Community-based health plays multiple roles in the broader health system. Let's highlight a few. Extension of the formal health system. Community-based programs extend the reach of national health systems into areas where hospitals or clinics may not exist. Education and behavior change. By teaching communities about hygiene, safe childbirth, breastfeeding, or disease prevention, these programs change daily habits that affect health outcomes. Early detection and referral. Community health workers often identify illnesses early and refer patients to higher levels of care, preventing complications. Building trust between communities and health systems. Community-based health bridges the gap between formal medical institutions and local populations, reducing mistrust and increasing service use. Empowerment and participation. These programs empower people to take ownership of their health, encouraging collective actions such as building latrines, organizing vaccination drives, or supporting vulnerable families. Through these roles, community-based health becomes not only a provider of services but also a catalyst for broader social development. Section 5. Strategies of community-based clinical health. How are these roles put into practice? Strategies are essential. Community-based health uses a range of strategies to achieve its goals. Community health workers, CHWs, one of the most effective strategies is the training of local people as health workers. They provide first aid, basic treatment, health education, and referrals. Because they are part of the community, they are trusted and accessible. Health education and promotion, campaigns on nutrition, breastfeeding, hygiene, and safe practices are tailored to the community's culture and language. Community mobilization, engaging local leaders, schools, religious organizations, and women's groups ensures wider participation and ownership. Outreach services, mobile clinics and vaccination teams bring services to remote areas. Integration with other sectors, partnering with agriculture, education, and local government to address the social determinants of health. Sustainability planning, building capacity within communities so programs continue even when external funding ends. These strategies are not isolated, they work together to create a web of support around communities. Section 6. Conceptual frameworks for community-based health. Frameworks provide structure to guide program design and evaluation. Several conceptual frameworks are commonly applied. Primary Health Care Framework, rooted in the Alma Ata Declaration, this framework emphasizes equity, prevention, and community participation. Social Determinants of Health Framework, this recognizes that health outcomes are shaped not only by medical care but also by income, education, housing, and environment. Programs must therefore address these factors. Health Promotion Model, this focuses on empowering individuals and communities to adopt healthier behaviors through education, motivation, and supportive environments. Community Participation Framework, this framework ensures communities are engaged at every stage: assessment, planning, implementation, and evaluation. Using such frameworks ensures that programs are not only effective but also grounded in principles of justice, equity, and sustainability. Section 7. Challenges in implementing community-based health. While powerful, this model is not without challenges. Some common barriers include limited funding. Community-based health often relies on donor support, which may be inconsistent. Human resource shortages. Training and retaining community health workers can be difficult. Cultural resistance. Some communities may resist outside interventions if not handled respectfully. Weak integration with national systems. Without strong links, community programs may become isolated and unsustainable. Addressing these challenges requires strong leadership, supportive policies, and continuous community involvement. Conclusion to Module 2. In this module, we have explored the practical application of community-based clinical health. We began by understanding the community as the central unit of care, identified the defining characteristics of this model, and reviewed its objectives. We examined the multiple roles it plays, from extending health systems to empowering communities. We then studied strategies such as training community health workers, education, outreach, and mobilization, supported by conceptual frameworks that guide effective practice. Despite challenges, community-based health remains one of the most effective, equitable, and sustainable approaches to delivering care, especially for vulnerable populations. It embodies the spirit of equity, justice, participation, and health for all. As future practitioners, policymakers, or community leaders, your role will be to not only understand these concepts but to apply them, adapt them to local realities, and continue building systems that truly serve communities.